Welcome to Waywut, your weekly verbal double take. This is a rabbit hole podcast where a couple of old guys do moderate to shallow dives into various topics, ranging from true crime, paranormal, sports, pop culture, or anything else that we find interesting. We drop episodes every Tuesday and on Fridays if we feel like it. You can follow us on Facebook, X, and TikTok. We appreciate you joining us. And now that we got all this self-promotion stuff out of the way, here we go. Hello. This is Daryl with the Waywut podcast. I wonder how many people just stopped listening or watching because of how bad that was.
Yeah. Nope.
Yeah, it's like, get the fuck off. Hi, my name is Daryl, and I will be guiding us through today's topic. And here I am with the guy that figured out he is more effective than a doctor's urinalysis test after drinking out of the wrong cup while at the doctor's office. Jason. Swish it around.
Kind of like a giraffe did.
Mushrooms. Interesting. Coke. Who's your hookup? Anyway.
Learn a little thing or two for the giraffes.
Oh, God. I try not to think about that.
That shit's hilarious. There is a part 2 coming of that, by the way. It is fantastic.
Oh, okay. And for first-time listeners, it's about Jason's Naughty by Nature episode. You can go back and watch it.
Yes.
Okay. So, as usual, I got something to rant about. And today's rant is a paranoid rant. I am very pleased with my life. I am married to a wonderful woman. My children are great. I enjoy my job. I get to travel a lot, and I've seen more of the world than I ever would have dreamed that I ever would have. And now I have a podcast with my best friend. All of these wonderful things have left me terrified that something horrible is going to happen. I've grown accustomed to difficulties and situations and problems and all that.
Yep.
I was always accustomed to my personal life being difficult. I'm used to having a job with some horrible company that I feel bad about what I'm doing and I hate myself while I'm there. I'm used to not having enough money to travel around and enjoy life. I'm used to writing stories or screenplays that I don't do anything with because I don't want to find out that I suck at writing. The way my life began, gradually turning around away from all that, especially this last few years, has been like a dream. And I've been conditioned to not let my guard down. I feel like I'm being propped up for it all just to get knocked out from under me.
Yeah, you never know when that can happen.
Yeah. I mean, not that long ago, I went in and had this calcium score test done where they put you in like this, you lay down and they have like this x-ray go around you like really, really, really fast, and it x-rays your chest looking for calcified cholesterol in your arteries and stuff, because I was certain that I was about to have a heart attack just because I'm too happy right now. Granted, no calcified stuff was found in there. I was completely out of my, I was a little paranoid maybe.
Made you feel a little bit better about that paranoia.
Yeah. I would like to make a very important point in this rant, though. Yes, I am afraid of things all going wrong, but I am not ruled by that fear. I'm making sure that I make the most of all the, all these wonderful things, and I'm trying to enjoy every second of it. However, if that enjoyment that I'm embracing right now was an empty parking lot at night, I would occasionally be looking over looking at the beautiful night sky and occasionally looking over my shoulders with my keys in between my fingers.
Yeah,
just ready to
jab somebody
pick something out. Yeah, that's how I feel. It's like, oh wow, it sure is pretty outside tonight. Sure, it's gonna
Almost
be
too
a
pretty.
shame if I have to stab someone. So, no real lesson in any of this. I just wanted to bitch about the fact that I can't shake the sense of dread that's been ingrained in my very soul. that I'm just certain that, I'm not supposed to be happy.
Well,
So,
life is a bunch of ebbs and flows, and when you're always ebbing or flowing, whichever one is going up, you're
flows,
waiting
I
for
think
that down.
ebbs when it's coming back, flow is going in. So, I don't know. Just
Well,
hills, peaks and
ups and downs.
valleys.
There we go.
Peaks and valleys.
Yeah, when you're on top of that peak, you know that eventually you're going to be coming back down to that valley. It never stays up, and that's the scary part.
I always felt like I had valleys with slight hills. With slight hills. Right now, all of a sudden, I'm on Everest, and it's freaking me out. So,
I feel you.
well, today I am going to go over a time where sense of dread was more justified. Uh, I could just spitball example of one of these times. How about like right before you have surgery?
Oh, I got some
Mm-hmm.
experience in that.
Oh yeah, where uh, we're all confident in our doctors. I mean, you don't go to them if you aren't, but there's always going to be some apprehension before you go under the knife. You're like, okay, what if they knock me out and I just never wake up? You'd be crazy if that thought does not cross your mind. That's an appropriate
Yes,
concern.
it's a valid response.
Well, I'm going to do my best today to make those feelings a lot worse.
Yay!
Yes, because today's episode is modern medical horror stories.
Ooh.
Yeah, so our very first episode was medical horror stories, and that was the one I did. And I came across some, and all the ones in that one, if you haven't gone back and listened to our first episode yet, which if you did, I'm sorry, we were still we were brand new at it. But all most of those were in like the late 1800s, early 1900s, and then it squeaked up into the 50s. These are around now, so they could still happen.
We may have some overlap here. I've written an episode that is possibly some similar to this one.
Well, snooze you lose, bitch.
Mm-hmm. We'll see. Hopefully, you didn't cover any of them. It'll be
We
totally
shall
different.
see. In April of 2016, a Japanese woman was undergoing a surgical procedure at the Tokyo Medical University Hospital. The surgeons were performing a cervical conization procedure. This is a procedure that is typically done for like biopsies or removal of abnormal cells from the cervix. So they're up the lady's hoo-ha.
Oh, going that way?
That's where the cervix is.
I thought they would do like a little laser surgery or something. Okay.
Well, if it's a biopsy, they typically use a knife. But in this case, they were using a laser because they wanted to destroy the potentially dangerous cells, burn them out. So they're going to be firing a laser up this lady's business. While the procedure is normal, the results from this one was anything but normal because during the procedure, the patient caught fire.
She must have had a drink the night before.
Without warning, the patient's thighs and bottom caught fire and experienced severe burns.
Wow.
Everybody was baffled. Like, what happened? There were no alcohol based antiseptics used on the patient. And eventually, because they knew that they had something hot flaring in there. They were just trying to figure out what ignited. There were no alcohol based antiseptics put on the patient. And eventually, the theory they settled on was that the patient farted and the gas was ignited by the laser.
What?
But you just can't say it because it sounds ridiculous.
Yeah.
So they recreated the conditions and replaced the patient with a doll.
Okay.
there are a lot of photos of the test, and I'm fortunate to work for a company that sells medical dummies because the pictures have uh, this medical doll in stirrups, and it's not very anatomically correct orifices. I'm used to like the ones I work with. It's always like a back, and you see like a butt crack or whatever.
Yeah.
And I think they even had somebody like model for it, and that's what I'm used to seeing. And this, you just see these legs up, and there's like this big giant hole that's like not, it's like wow,
A hallway.
yeah. Let's be like, well, her and I would not have a healthy relationship. All right. I mean, at least I hope that's not. Yeah, because like you're right. That's a hot dog down a hallway. I don't want nobody could do that. Although I've seen
No.
some guys on the internet that probably could. Well, they found that the most likely the woman farted and the fart got sucked up into her hoo ha. So she's laying on her back at some point. I mean, it didn't have to be right then. They're just saying at some point she farted and the gas went up and her hoo ha just sucked it up. They did this by tracking smoke fumes through a tube to figure out how the fart got put directly in the laser's path. There are, because there's some separation there normally. So they're like, okay, if our laser's firing here, how'd this happen? And so whenever they what they did, I mean, they could have just asked some women, but this is Japan, and I doubt they would have answered because I've heard more than I ever wanted to hear about their farts and how their farts sometimes interact with their lady bits. And it's things I wish I could forget, but apparently, yes, farts can go up their hoo ha's. So they then tested this on fart gas that they made out of. So they got fart gas that they essentially made or collected or whatever, and they put the fart gas on lean beef and it zapped it with a laser, and it caught fire after a small explosion.
Damn.
Yeah, it's. I mean, I still get a little flabbergasted when I'm talking about this because the lady's fart caught on fire in surgery. Um, and
An
on top of
old
that, it was
fart that.
a stale fart. Yeah. So the hospital,
Oh man, how do you explain that to the insurance?
you don't. The hospital took the results from this third party test. So it wasn't the hospital did this. They hired a third party to figure it out, and they added it to their laser training, as well as conducting additional firefighting drills for the surgical staff. Uh, I
Question.
mean, okay.
You may get to it, so I will wait.
Well, this is
I,
about the end of this one, so go ahead.
so now that this has happened in this surgery, did they now have to test for fart gas in next surgeries for females?
I don't know. I don't know. I mean, honestly, what I think is because there's a lot of times whenever they do surgery on stuff, what they'll do is they will blow air inside to cause the area to inflate, give them room to work around with, things along those lines. I don't know if they just jam that up there and just
Clear
clean
out a
it,
fart?
for lack of a better term. Just give it a quick,
Turn on the exhaust fan?
something. So, if you're going to have surgery on your lady bits with the laser, just I don't know, plug it up or something the day before.
Ah, that's terrible. That is terrible.
I mean, on the plus side, I mean, this has to be like a crazy one-time situation, right? I mean, no one else has to worry about catching on fire during their surgery, huh?
I'm pretty sure this is leading to another story.
In December 2022, A 51-year-old cancer patient named John Michael Murdoch was having a tracheostomy done because of the cancer inside his tongue. During the procedure, it's alleged that a spark came from one of the surgical tools and ignited the alcohol on his face. The patient dealt with severe burns, swelling, and disfiguring scars. He died 6 months after the incident from his cancer, but his wife sued the doctors after his death for making his last 6 months full of discomfort and trauma.
No shit. Talking about bad luck. What the hell did this guy do?
I don't know. It's just unlucky.
Why did he have
Don't-
alcohol in his face? Like,
Antiseptic.
okay,
You
okay.
keep things
There,
disinfected,
yeah. Okay.
especially if that's where they're going to be working. I
Damn, that's
don't have
terrible.
I don't have any more information about this specific incident, but I did find that since this, independent organizations began, tracking situations like this since 2015, they have found hundreds of surgical fires happen every year.
Dang.
There have been cases tried in various U.S. courts regarding fires started by cauterization devices and laser devices. The independent organization called the Joint Commission, I hate that name because it tells me nothing about them,
Uh-uh.
uh, have called for performing surgical fire risk assessments before all surgeries, providing fire safety training to all surgery teams, maintaining oxygen levels only as high as necessary because,
Oxygen's flammable.
oxygen, yeah, and close monitoring of all electrosurgical devices. Which my response is, why the fuck weren't they already doing that? That's terrifying. You should be doing all those things anyways.
Mm-hmm.
You
I,
should just.
doctors and anesthesiologists get lazy on their jobs too.
I mean, how many people got to catch fire in
At least
surgery?
hundreds. At least hundreds.
Apparently,
There's a cutoff, just like in the FDA. There's so much rat poop that could be in your oatmeal or whatever. Well, they can at least have 100 fires a year.
the moral of the story: watch your ass and hope your surgical staff doesn't burn you up next time you go in for surgery. Good luck.
I'm glad those surgeries I've had are in the past. So that's not a new worry. I never thought about catching fire.
I didn't either until I researched this.
Oh, man.
Knowing that surgery has risks, including catching on fire, it baffles me when people do elective surgeries. There's always a risk with surgery, period. Uh, because they are cutting you open. Everything's enclosed because it's supposed to be. Uh, and whenever people do elective surgeries, which are pretty much always cosmetic, or at least mostly cosmetic, it has to be parts that you care enough about improving, such as your face or tits, that you're willing to like die or, I don't know, potentially destroy what you're trying to improve.
Yeah, or be in pain for months.
You're putting it at risk of losing exactly what you're trying to fix. Similar to how some Americans go to Mexico for cheap cosmetic surgery, which again I don't get.
Pay for what you get.
Yeah, the British do something similar, except they go to Turkey. A 31-year-old woman from the UK died following a Brazilian butt lift surgery in Turkey.
Why
Another
go to
woman,
Turkey?
she went and got a
Obvious place is in the name.
another woman, 38 years old, died following a tummy tuck. These are typically from post-surgery infections because they, I don't know, go to a third world country to get cheap surgery.
Uh-huh.
Infections set in, they die. It's horrible. But these deaths from going to Turkey are not what caught my eye. and why I want to talk about British people going to Turkey.
Okay.
A UK doctor named Gordon Muir claims to have had scores, so 20s, of young male patients over the last 10 years that have returned from Turkey with botched penis enlargement surgery.
Oh, how do you, okay. Lots of questions. Lots of questions.
I don't want to get discount surgery on my pinky, but I sure as hell ain't going to bargain shop for anybody that's going to do stuff to my dick.
Very
Whenever I
true.
got my vasectomy, I did not go on Groupon. It's like, oh, that's kind of delicate, but man, that sure
Yeah.
was a lot of money.
You know those receipts you get at the grocery store? You turn on the back and you get 2 tacos for $1.
Yeah.
You didn't use one of those?
No, I didn't like get a green sheet out of one of those free newspaper beds and find my vasectomy doctor there.
Wasn't in the ad pages in your mailbox?
No, was it in the Valpak, the Valpak
Valpak.
mailer?
Hey, we got a
Uh,
coupon. Oh, we got another one to trim our shrubs outside.
it's the same guy. What the hell? Crazy.
That's pretty good.
I guess doing it at the truck stop wasn't getting enough money, so now he
No, needs more
combined
traffic.
it with landscaping, so it's actually, I would bring the vasectomy to you. Uh, Penis enhancement or enlargement only does slight changes to the length, and you can only see it when it's soft. So whenever they get a boner, it's still the same boner that they had before the surgery. It's just for, look how big my floppy dick is.
Yeah, look how well it looks in gray jogging pants.
I guess. I mean, for me, that kind of defeats the purpose. I mean, I would rather it perform its function. You
Yeah.
know, uh, I mean, and my thing is also, wieners look weird as it is. What's the point in doing something to your junk that's only going to alter its appearance and not its use? I mean, if it's a bigger wiener, okay, but it's still a bigger, weird looking wiener. That's how wieners work. Well, instead of ending up like porn stars, they instead end up with scarring, nerve damage, and in some cases, erectile dysfunction.
Yeah.
There are some cases where they lose complete penile function.
Oh,
Yeah. Nope, nope, nope.
constant drip.
Some surgeons cut the penile suspensory ligament that attaches the penis to the pubic bone.
Hmm.
They figure, cut the ligament, it's not pulling back anymore, it goes forward. Again, it makes it look longer when it's soft, but the joke is on them because the ligament could grow back together and it will make it look even shorter.
Got to go to rehab to stretch that thing back out.
I guess.
Don't they know
Other
if Don't they know if they just shave, it's an instant penis enlargement?
or do lots of core exercises, get rid of that pubic fat.
Mm-hmm.
Yeah, I don't
Shaving
know.
is easier.
I don't want to talk about any of that. All right. Other quack surgeons will inject fat, Vaseline, or silicone into the
Oh,
penis.
I've heard about Vaseline.
The doctor says that these tend to look like a dog has attacked it, and sometimes they have to surgically remove the filler that they put inside without a guarantee that the penis can even be restored to its previous appearance.
It looked like a fucking raisin,
You end up with like a mangled dick.
like a balloon that's been deflated. One of those long, skinny balloons.
Well, probably not long in these guys' cases. This is definitely a case of play stupid games, win stupid prizes. So in the end, I don't feel too sorry for them. They kind of did this one to themselves. I mean, I imagine going to a country to get surgery just because it's cheap is maybe half a step better than doing the surgery on yourself.
True. True. Spend the money if you're going to go through surgery. Do it
All
right.
right. Do you have an, do you have any dick questions? Because you seem to have some early, very early on in this.
Oh no! Just all of them popped up like, why, who, why, who? No, I equated it. What you said about it cutting the ligament. It's kind of like cutting that little thing on the bottom of your tongue to make your tongue roll out longer. I guess if they were to cut that,
Again, pointless and weird. At
yeah,
least it's not the thing where they fork it. Ow!
yeah, it looks kind
I
of
hate
weird.
that. I hate that,
Or
especially when they move it just independently. And I'm just like, oh my God, when you put that fucking shit back in your mouth.
yeah, when you could have a tongue like a pickup stuff, that's kind of weird.
Ah. That's one of those things that really, really gets me. I can't even look at it.
Yeah,
And
it's
just
like,
imagining it has already made my eyes water. Oh, God. Okay. Let's get away from wieners and tongues. The
oh,
final story of this episode is far more terrifying because it is a reminder that it doesn't take bad luck or a third world country to kill you in surgery. Sometimes it's just someone screwing up.
mm-hmm.
William Bryan was a 70-year-old man from Alabama that was on vacation in Florida. While on vacation, he began experiencing severe abdominal pain and went to the Ascension Sacred Heart Emerald Coast Hospital, that is a
Damn.
long name, to figure out what was going on. The doctors found a concerning abnormality in his spleen, and they convinced, sorry, I get all mixed up. And he was convinced by Dr. Thomas Sheknovsky and Chief Medical Officer Dr. Christopher Bacani to have an emergency surgery to remove the spleen.
Why can't doctors have easy last names?
I don't
It's like they
know.
get changed once they become a doctor. What would you like your last name to be? It's
It's
your
like,
choice.
as long as it makes a really messy signature.
Mm-hmm. It could be whatever. It doesn't have to make sense.
At first, Williams said he wanted to wait until he got home to get his regular physician's opinion, which was a very smart idea.
Very common.
However, those two doctors told him if he left without getting that spleen removed, he could experience serious complications. On August 21st, 2024, they put him
Oh.
under for a laparoscopic splenectomy. Using the scope, Dr. Sheknovsky went in and removed William Bryan's liver instead of his spleen.
Oh, the map's upside down. Damn it.
This mistake resulted in immediate and catastrophic blood loss, killing William Bryan very quickly.
Yes, you need your liver.
They didn't even realize he removed the wrong organ until the patient died.
I don't mean to laugh, but god damn, that's so inept. That's so fucking
Oh,
retarded.
yeah. It's it's not even near the same size. I mean, livers are huge.
No. And the one that needs to be taken out, you could probably tell the liver's nice and healthy and doing what it's supposed to do. And there's this pulsating other one over here, and you just left in there.
Well, here's where it gets really shady and shitty. They told his wife that he died from a splenic artery aneurysm and gave the same story to the medical examiner. Fortunately, this medical examiner was not evil like the ones I talked about in Corners for Sale or for Hire. Uh, and he found that the spleen had a cyst. Otherwise, it was normal. He's like, well, the spleen was mostly fine except for this cyst. The big problem is he has no fucking liver.
It's in that red trash bag.
He ruled the death a homicide with the cause of death as an exsanguination resulting from surgical removal of his liver. As of now, no criminal charges were filed against the doctor, but there is a civil suit in the works, which means that there's almost certainly not going to be a criminal trial. The doctor also has lost his ability to practice medicine in Florida and Alabama. I'm pretty sure she's going to win this. Apparently, though, it's being drug out it just happened not that long ago. It was just last year in August of 2024. So it's still pretty early on. This doctor, I could have gone on and on about his other screw ups, but this one actually got somebody killed in one of the dumbest ways possible.
Taking out a liver and not realizing you're taking out a liver as a doctor is a problem.
How pissed off would you be if you go to a mechanic to change out an alternator and he took out your radiator? They don't look anything alike. They're not the same size. No. I would call the dude an idiot and I'd be throwing a hissy fit. If somebody removes the wrong organ, that's nowhere near. Because livers are big.
Yeah.
Spleens are I think they're smaller than a fist.
Yes. And if it's about to explode, I'm sure it's looking pretty rough.
Yeah. This is a bad one.
That's terrible.
I can't stand that doctor, and I hope he has to pay that lady all of the millions, and along with that hospital that went along with Lion and helped cover in his ass. So there you have it.
That was a good one.
Yeah. We found out that surgery can result in burns, bad wieners, and death. I'm not saying don't get surgery. I want to put that disclaimer out here right now. I am not telling you to not have surgery. I am telling you, do your research to make sure that your doctor's not a psychopath, and do whatever good luck rituals that you can learn from your local bingo parlor, from the old ladies there. Whether it's, you got to blow on the troll's doll their hair 3 times. Okay. Now your surgery will go fine. That's my advice. Otherwise, good luck.
Wow.
Yeah.
Interesting stuff there, Squirrel.
Yeah. Nobody got their legs chopped off this time, and just the liver. Join us next time when Jason, if he isn't too busy flying to Vanuatu Island to get anal rejuvenation surgery, if he's back by then, he'll tell us some things. Oh my God,
I may need to go to this guy for other unrelated reasons.
I don't know what you did to it. I suspect it's the same thing that causes it to get tickled in the car.
Oh, it's fucking angry, Daryl. It's so angry right now.
Does it look like this?
It's like.
No, I don't think so. You don't need rejuvenation if it's making that.
Oh my God, it's constant. Never mind. We're talking about something else.
All right, well, join us next time.
We're recording there for a second.
If Jason ain't getting his butthole worked on, he'll tell us some stuff that will make us say, "Wait, what?" I can't tell.
Later.
Bye. Thank you for joining us for Wait, What? If you would, tell your friends or your enemies that they can watch us on YouTube or Rumble. And if you don't want to see our face, or if they don't want to see our faces, you can listen to us on your preferred audio platform. That's Spotify, Apple Podcasts, Amazon Music, Pandora, you name it, we're probably on there. Please like, review, and comment on whatever platform you joined us on today. We'd appreciate that a ton. Again, just thank you for listening and watching. We hope you'll join us next time. We'll make you say, "Wait, what?"